Hi, I'm Steve Adubato, coming to you remotely again, and we are thrilled to be joined by our friend Newark Councilman Anibal Ramos, who represents the North Ward of Newark. Councilman, how are you?
I'm doing well, Steve. It's always great to see you.
Same here. Last time we saw you was in the studio. Let's put things in perspective. The North Ward of Newark, I know well. You know, my family is still there. My sister Michelle runs the North Ward Center. But my dad started over, wow, it's going to be like 50 years ago, a city, an organization that serves the community. And let's talk about COVID-19. The North Ward of Newark devastated early on by COVID-19. How bad was it? Where are we today?
Definitely one of the wards that was most affected. I can recall the first case that my office worked with, someone who worked in a local doctor's office whose entire family or household became infected due to COVID-19. Thankfully, Claremont Hospital was very, very helpful in providing that family with assistance. Fortunately, the head of household did pass away, but we did get hit hard early. Thankfully, citywide, our infection rate has dropped significantly, but we're ever so vigilant. We recognize that there's spikes going on all over the country. The mayor today declared mandatory masking outdoors in conjunction with the governor's executive order from last week, and he's asked the Newark Police Division to assist with enforcement. So we're optimistic as far as where we are. But at the same time, we recognize that we have to maintain vigilance, and our residents have to take whatever precautions they can to reduce any potential infection.
Yeah, we are in fact taping on the 13th of July. Things are changing not just by the day, but by the hour, by the minute. Councilman, let me ask you this. The disproportionate impact of COVID-19 on Black and Hispanic citizens in cities like Newark and other urban communities throughout the state, Black and brown people. Why would it take this? Well, hopefully it takes this for us to recognize and take more action, but it has disproportionately affected those communities, correct?
Most definitely. I mean, on your show, you've had over the years healthcare professionals talk about, how our minority communities have incredible incidence of diabetes and other ailments, which really impacted them in a very negative way when it came to dealing with COVID-19. Hopefully this crisis will really highlight some of the disparities that we have as far as access to healthcare in cities like Newark. The North Ward still has a considerable number of primary care physicians, which is a benefit to our residents. But you have sectors of our city that no longer have the availability of primary care centers. And one thing that was very helpful to me personally in this whole ordeal, in making sure that my seniors who were homebound had access to testing and other preventive kind of care, was a partnership that we established with one of our federally qualified health centers. And to me, those programs do a lot in making sure that communities like ours have access to at least, preventive care and some primary care services.
Councilman, let's talk about this. Part of our programming in the post, I hate even saying this, the post George Floyd era, where we should have been doing this. We should have been having a series called Confronting Racism a long time ago. We've done some, we haven't done enough. That being said, the relationship between the minority community and the city police department, led by the public safety director, Anthony Ambrose, who I know you have a very close relationship. Anthony was born and raised in the North Ward of Newark. You were born there, raised there, same here. Describe that relationship between the minority community and the police department, and why, even though there's been a history of a lot of problems, with the federal monitor there as well, the Justice Department in there, how are things getting better, and what do we need to do moving forward? Loaded question, I know.
Well, I was part of the investigative committee that looked at some of the, alleged abuses of the Newark Police Division when the federal monitor first came in. And I have to tell you that 11 years later, you have seen incredible progress when it comes to establishing positive and meaningful relationships between our police division and the community. Some of the incidents that you saw, after the killing of George Floyd around the country, we had very peaceful protests in the city of Newark. And even though there were some outsiders who came in with different intentions, it was really the community that stood up and said, we're not going to allow you
That's
to
right.
come into the city of Newark and destroy property and turn back what we feel is a relationship that's been built with our police division. We have a strong clergy affairs unit that's very actively involved in organizing community groups and responding to shootings. We have an incredible community affairs team that's comprised of police officers and firefighter officials, and they do a lot of work with our local schools. And I definitely give a lot of credit to Public Safety Director Ambrose, because he brings not only credible experience as a public safety leader, but he's also someone that recognizes that the only way we can achieve effective crime reduction in a city like ours is to have that strong relationship with the community. He firmly believes that our officers are guardians as opposed to warriors. And the mayor of the city, Mayor Baraka, definitely also deserves credit, but Director Ambrose has really been the key in making sure that relationship is strong.
Council, before I let you go, I got 30 seconds left. We had the mayor on as well, Mayor Baraka, who said the whole idea of doing away with the police is not a realistic idea. Defunding and diverting some of those dollars into social services, into a whole range of other areas, social workers and others who can be helpful. You don't believe in doing away with the police at all, correct?
Well, I recently wrote an op-ed which really focuses on rethinking what we expect from our police department or divisions. And I think after the unfortunate killing of George Floyd, we saw nationwide movements to quote unquote defund police. But part of my mission in the opinion piece was to really educate residents on how much we expect from our police department and divisions. They respond to everything from animal control complaints to addressing homelessness issues, mental health evaluations. We expect a lot from our police division. But at the same time, I believe in the city of Newark, we've already begun the process of creating prevention programs under our police division. And part of our debate with the mayor in expanding those programs was, how do we fund that? Because 90+% of the police budget is personnel costs. So any reduction in police budgets is going to unfortunately result in potentially laying off officers. And in Newark, we were able to reach an agreement with the mayor, a lot of it based on my suggestion, that we would fund some of these violence prevention initiatives that we don't already have in place. We have a number of them in place, primarily through attrition. And that's a way to safeguard our department, to ensure that we have officers in place to continue to respond to resident complaints and concerns. And at the same time, moving forward, we would have access to additional resources to further fund some of these prevention programs that the mayor has envisioned.
Councilman, complex, important issues, and I want to thank you for joining us and wish you and your family all the best.
Thank you, Steve. Thank you so much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the North Ward Center, the New Jersey Education Association, PSC&G, Investors Bank, the Healthcare Foundation of New Jersey, New Jersey Institute of Technology, Atlantic Health System, the Port Authority of New York and New Jersey, and by Eastern Atlantic States Regional Council of Carpenters. Promotional support provided by bestofnj.com and by New Jersey Monthly.
I was diagnosed with cystic fibrosis when I was 2. It's hard to grow up with CF. But I have an awesome care team at Goriab Children's Hospital, helping me do the things I want to do, like play lacrosse. And now I've been recruited to play in college.
Where you go for pediatric care matters.
Atlantic Health System, because every moment is a moment that matters.